is born, someday they'll be full of hopes and dreams. It won't be very long till they move out on their own, 'cause that's the way that life's supposed to be. But something isn't right, there's a lost look in their eyes. They're crying out, why can't you just see? I'm in here when the joy turns to crying. See the world through my eyes for just a moment in time. I'm in here, oh don't you know I'm trying to find a way to show you who I am.
One in every 150 children is diagnosed with autism. Children that are diagnosed with autism have trouble communicating, socializing, and playing. They are often ostracized by the community, being left out by their peers, or worse, judged by adults. Some children with autism have a strong desire to interact with other people, but oftentimes they just don't know how. Their attempts to interact can be awkward or misconstrued. Children with autism can be loving, sweet, and funny. More often than not, they are simply misunderstood by society. This is Jamie McGilvery from Beaumont's Hope Center. Today on Spreading Hope, we're going to examine just how close autism comes to home. And you'll learn the common warning signs to look for in children. Dr. Lori Warner will introduce you to a family that will take us through their journey to find hope. And last but not least, you will hear firsthand how parents wished others would respond to their children with autism. The game 6 Degrees of Kevin Bacon has become popular in the past few years. Many radio shows host call-in game shows to see how to connect an obscure movie star to the famous Footloose star, Kevin Bacon. This game illustrates the popularity of Kevin Bacon, but more importantly, the fact that we are all really connected. Today, we use this same premise to play the game 6 Degrees of Autism. You may be surprised that you're no more than about 6 people away from somehow being connected to someone that has autism.
I do know somebody with autism. I'm involved in Boy Scouts, and I've dealt with a couple of young men who've overcome some of the handicaps or some of the disabilities that they have with autism. And one of them recently became an Eagle Scout, and we're all really proud of him, both his parents and all the other guys that are involved in the Scout troop.
Yeah, basically both my sisters, they had a scare with autism when both my nephews were born. So they read up on it a lot, because I guess, I guess it is kind of well known. They had some scares with it, and so everything turned out to be okay, but I guess the symptoms are kind of hit and miss.
As far as autism, I've seen a lot about it on the news, and I know that Holly Robinson Pete's son has it, and Jim Carrey's wife, so I don't know much about it, but it's something that I would like to look into because anybody can have it.
I'm always very aware of autism, especially now having my own child. I just think I read more research into it and just make sure I'm aware of it to look for signs in my kids or even her friends, and something that's kind of prevalent right now.
I have a neighbor that more or less raised a grandson that had autism. She helped him a lot. He goes to a school for autistic children, and he's doing pretty well. His grades are great. He's on the high end of autism. He just has the problems of his temper, but he's very smart.
It's incredible to hear how autism connects us all, yet so many people are still unaware of this epidemic. You may be thinking, well, I hear about autism all the time on the news, but what does it really look like? What are the signs? How will I know if I run into someone that has autism? Well, the warning signs of autism can be seen as early as 12 months. Here you see a child playing with his mother. Notice how the child watches as his mom moves the toys past him. He gazes into her eyes as she talks to him, and he plays games with her. One important skill that we see in children that do not have autism is called joint attention. Notice how he looks to see if his mother is attending to the toy. Many moms that have children with autism do not know the joys of these interactions. This child has been diagnosed with autism. Notice how his body posture indicates he'd rather be alone. It's challenging to get and keep his attention. He does not make attempts to share his joy with his mother. Many mothers tell us, "I thought I had the best baby in the world. He was very quiet, and he didn't need me to do much of anything." Looking back, they can see that that really was not quite right. Every child progresses at a different rate. By 12 months, if your child is not responding to his name, sharing his experiences with you, or beginning to point for objects that might be out of his reach, it may be means for concern. Autism becomes easier to detect as a child gets older. Communication difficulties become more obvious, and behavior problems such as severe tantrums, an inability to tolerate being told no, may begin to emerge. Many people think, well, my toddler hates being told no, and he tantrums all the time, and he doesn't have autism. Well, you're right. Sometimes there's a real fine line between what is autistic behavior and what is the behavior of a typical child. However, the behavior of a child with autism is most often more severe and much more debilitating. If you fear that your child is not communicating the way that he or she should be, or prefers to be on his own, is stubborn or non-responsive when it comes to following directions, and he tantrums excessively, then it may be time to talk to your pediatrician. Stay tuned at the end of the program for contact information of professionals that can help.
We're here in the studio with a mom who is near and dear to our hearts. This is Tammy. She's the proud mother of Spencer, age 9, and Drew, age 7. Tammy's youngest son, Drew, was diagnosed with autism when he was 2 years old. So Tammy, welcome. Thank you for coming today.
Thank you for having me.
And thanks for coming, Drew. And he's going to hang out with us and play while we talk. So I have a few questions for you. How is it that you first found out that Drew had autism?
Well, Andrew developed typically when he was young, met all his milestones, but suffered a series of seizures around 18 months, and after that seemed to lose a lot of his skills. He became very self-injurious, very unhappy. His whole appearance changed. His face turned ruddy and red. He just lost all his words. We sought medical advice through our pediatricians and a neurologist, and no one seemed to know what was going on with him. We floundered for about a year, and autism kept reoccurring, but our concept of autism was the Rain Man autism that we had seen in the movies. We didn't know anything about regressive autism, so we really didn't find out until Drew was over the age of 2, and we found out through a great doctor through Detroit Children's Hospital, and she was able to give us a diagnosis at that time.
Great. So can you tell us just a little bit, highlight your journey through helping Drew? What was it that you went through and all the different steps that you took, and sort of go through that journey?
Sure. When we got his diagnosis, we felt like we were hit by a truck, and we didn't know what to do. And we went home and remembered that one thing that the psychologist had told us was to look into ABA. And so my husband went home and immediately got on the computer and started searching the internet for information on ABA as well as on other interventions. And we found the Hope Center. So that was our first step. We called and were able to get in almost immediately. We were very lucky. And I quit my job and we began the program. And that was really the first big thing that helped Andrew, because it gave me the tools to communicate with him and to get him to start communicating with us. After that, we started dabbling in some biomed interventions, and I've done quite a bit of them now, and he's doing great.
That's wonderful. So you kind of had a blend of different types of therapies that you tried. Started with some different behavioral types of interventions. Continued that, though,
yes.
correct?
Yes, we still do ABA in our home today.
Yeah, that's
so
wonderful.
When he was 2.5 to 5 years old, we did 40, 50 hours a week of ABA, and now we do about 10.
Okay. That's wonderful. So what are some things, too, I think it would be nice for our viewers to see some of the things that you were able to do to help Drew, but what were some other things that people have helped or hindered you throughout? So